Hello everyone, welcome back to my YouTube video channel. I'm Dr. Wen. Today I will just explain to you what is the gum disease, what is periodontal disease, what is gingivitis. I'm going to quickly show you the slide so we can get started. And here is my slide. Let's share it and let's talk about this. I'm going to do the slideshow. I will start right now. What is the gum disease? A lot of people know that your dentist always tell you got a gum disease. And so I want to clarify again, only just a few minutes with you guys, okay? So gum disease is known as periodontal disease. That's the term that we use in dentistry. It's basically the inflammation caused by the bacteria grow in the mouth around the tooth along with the gum line. So again, gum disease is the inflammation process that caused by the bacteria grow around the tooth along the line. What it actually means is that when the bacteria produce the toxicity around the gum, it will eventually destroy your bone. So I'm going to continue this conversation. Is gum disease preventable? Yes, it is preventable when you have the early stage. So in the early state of gum disease, it's called the gingivitis. It is a common problem in 3 out of 4 people who have gingivitis. That is the earliest state of the gum disease. So gum disease is common at the beginning, but it's not. It is not usual when you turn into the gum disease. It's a process where it takes a long time to destroy your gum. It because of the lack of prevention process of cleaning. Dental hygienists or dentists clean your teeth and go see your dentist. Unfortunately, this preventable disease can cause tooth loss if not treated. And we can talk more about in detail. I just want to have you a quick idea about what we're talking about here. So what are the states of gum disease? There's 4 states, okay? In generally, um, if you left untreated, gingivitis can progress into serious condition, periodontitis. We call periodontitis, basically a gum disease. So the early state of the gingivitis is preventable. We can do cleaning, we can reverse that situation. Gingivitis is the first state of the condition. So we're going to talk about the 3 or 4 state. State number 1 is gingivitis, the first state of the gum disease. Its symptoms include inflamed red gum that may bleed when you brush. Remember, symptoms include inflammation of your gum, redness of your gum. It may bleed when you brush, or it may bleed when you floss. And you might have bad breath as well. So gingivitis. State number 2 is early gum disease. Early periodontitis is slightly loss of bone support around the tooth, and the other symptom may not be easy to observe, but it's the quiet condition where you do have some bone loss, you do have some bleeding, but then it's so quiet that you don't even realize that you have gum disease. And it's going to state 3, which is moderate periodontitis, moderate gum disease, where you have more bone loss, more gum tissue is destroyed, and loosened tooth may occur. You might see your tooth may be mobile, loosen up. And state 4 is that an advanced condition where this is the most severe stage where you're going to see more bone loss. It's hurt when you bite, when you eat. Extensive dental treatment required to correct this problem. It may not be correctable anymore, so it needs surgery. And the stage 2 and stage 3 and 4, you only need surgery. Stage 2, you need to have a good protocol to maintain your teeth with the dentist. And so this is an example of the case where we just saw yesterday. Patient haven't seen a dentist for more than 10, 15 years, and noted that The upper teeth have a lot of abrasion. This is the condition where the either decay or wear and tear at the gum level. And on the bottom, he not only have abrasion, but also have the plaque accumulation around the teeth, and also have a lot of inflammation around the teeth. And if you were to measure the pocket of this tooth right here, you're gonna see is very deep. It's like 9-10 millimeter, and the tooth really loose. So this is another angle. You see, I'm talking about the abrasion on the top, and the bottom tooth is a lot of plaque accumulation. Here's just a different angle. Anyway, the difference between gum disease and gingivitis, periodontitis, we talked about that already. It's very confusing, but the bottom line is gingivitis is the beginning of your gum problem. The rest of the other consider called periodontitis. Periodontitis have type 2, type 3, type 4, and it's get 4 is really bad, right? So if you don't treat your gingivitis, you may be losing your teeth when we turn into gum disease. So make sure you see your dentist. Now, this is just a quick example how a dentist treat your moderate to severe gum disease. Some people have localized gum disease. Some people have a generalized gum disease. So the more you have generalized, the more the dentist flap it out like this, and then recontour your bone, and then reflap your gum, suture it up, and after a few months, your pocket will be sustainably reduced, and your gum will look a lot more healthy, and the bleeding and all of that will be getting better with minimum bleeding, and so it takes a lot of therapy, a lot of effort from the patient and the dentist to treat your gum condition. You don't want to get to this state, you guys. So if you have the gum problem, make sure that you see your dentist, go see your dentist, get the cleaning, get the management care, and also improve your hygiene by brushing and flossing daily. Using salt and warm water is a very affordable way of maintaining your teeth. So have very good bacteria control mechanism where it kill the germ, kill the bacteria. And so it also help your gum to heal faster too. So I encourage you guys to use salt warm water. All the mouthwash that you can see on the market, some of them are very effective. And so check out, talk to your dentist, and get the best care to reduce not only just to help your gum, but there's a link between gum disease and heart attack, stroke, or diabetes, and this whole body care. Very important, you guys, to work with your dentist. Thank you for watching, and if you like what I just short taught to you today, give me a thumb up, click the like button, subscribe to my channel, and I hope to see you on another video. Thank you for watching, and you have a beautiful day. Thank you. Bye bye. Take care, you guys.